Over 441,000 people have died from the COVID-19 pandemic in the United States, which is greater than the number of American service members we lost during World War II. I know that all of us on this committee are committed to stopping this horrible virus. Specifically, I think we must fully evaluate our country's response efforts on what has worked and what lessons we have learned thus far during the COVID-19 pandemic. Our focus needs to be forward-looking in order to make continuous improvements that will stop this virus. Each of us has a choice to make. We can stay in our camps and focus on ideological battles, or we can sit at the negotiating table and get work done that the American people expect us to do during these challenging times. We need to examine ways to further expand testing, use of therapeutics, and increase vaccine confidence. We also need to prioritize quick and efficient distribution of vaccines. Let me be clear, we are not starting from scratch. Without Operation Warp Speed, we would not have 2 vaccines that are currently being administered to Americans, nor potentially additional vaccines that may be authorized by the FDA in the near future. The Biden administration has taken credit for a pathway to 100 million vaccines in 100 days. However, 2 weeks into the Biden presidency, there have been around 52 million vaccines distributed and more than 32 million vaccines administered, thanks to the previous administration's efforts. As we move forward with vaccine distribution, we will find ways to improve, and we should explore those. Let us not forget this is the fastest we have ever had a vaccine move through the development pipeline and come to market. We never cut any safety corners despite the extraordinary speed, and that is success that should be celebrated. Additionally, I've heard from Kentucky and many other states that the lack of additional federal funding for states to distribute vaccine has been the biggest hiccup. We had 2 vaccines authorized prior to the latest funding package that was signed into law at the end of December. Let us not forget that this package was stalled for months. Valuable time was lost. When we did move forward, Speaker Pelosi said she moved forward because of a new president and a new vaccine. The money being sent to the states 2 weeks late, when it needed to be weeks, if not months before, has cost us valuable time. From my background in manufacturing, I know it takes time, hard work, and detailed planning to get a manufacturing line up and going. Operation Warp Speed's tireless work on supply chains and simultaneous manufacturing during clinical trials meant safe and effective vaccines that were administered to our healthcare heroes and vulnerable populations within a matter of days rather than months after receiving FDA authorization. Each state and some large jurisdictions have been given the opportunity to run their vaccine distribution as they believe is best for their residents. I'm not sure if anyone here is familiar with Utica, Kentucky. It's a rural community in my district that I'm proud to represent. I think Frankfort, our state capital, and Davis County can do a better job taking care of Utica than being run out of Washington, D.C., which is probably a person who's probably never stepped foot there. While some states may need to reevaluate their strategy, there are many states that are doing quite well with vaccine distribution. In addition, I think it's key to remember the work the FDA has done to authorize 320 COVID-19 tests. According to the COVID-19 Tracking Project, this Monday, we have more than 1.6 million new tests reported in a day. On March 31st of last year, we had less than 116,000 new tests reported. Over the past year, we have seen the development and authorization of rapid point-of-care diagnostics to reduce instances of delayed results, tests using saliva samples to eliminate the need for swabs in short supply, and even a test that is sold over the counter. While challenges remain, we have demonstrated that these types of private industry partnerships and the innovative products that are a result are essential to successfully responding to the pandemic. Lastly, as a Republican leader of the Oversight and Investigation Subcommittee in the last Congress, I believe that oversight is a very important aspect of our response. We have passed around $4 trillion in COVID-19 aid alone, have supported much needed relief for American families, workers, and small businesses. We must ensure it is being used effectively and wisely. And I agree, Madam Chair, that we have an esteemed panel of witnesses. I look forward to hearing their testimony along with my colleagues. I hope my colleagues will join me in finding solutions and acknowledging how far we've come and work to get even further as we go forward. I yield back.